Hello, my name is Bruno Gobato. I'm speaking from Brazil. I'm very happy to be here with you presenting in the ICJR Middle East in Dubai. I'm going to present about 3D technologies to joint reconstruction, do-it-yourself for knee and hip. Well, first of all, I have to thank you very much these two gentlemen, Dr. Samir, our chairman, and Dr. Mohammed El Feki. It's a close friend from the social media. Thank you very much for the invitation. Thank you very much for having me at least digitally and virtually with all you guys. I'm from Brazil, I'm from South America, and I was planning to travel actually half of the road to meet you, all you guys in Dubai. But I had a minor problem. I had a cholecystitis and I have to be submitted to a cholecystectomy. This is the video just some days ago. I was on antibiotics just until yesterday, and my surgeon asked me not to fly to Dubai because of the risk of pancreatitis. So I have to cancel my in-person being with you. So please, guys, if there is anything you have not understand, if you have any doubts or any comments, please feel free to contact me over my email or in my personal mobile phone. Here we can chat over WhatsApp. I will be very happy to chat with you guys, to connect with all you guys in this wonderful meeting. I have no disclosure for this presentation. All that's shown here is my personal practice. I'm a shoulder and elbow surgeon, and I'm going to speak here about knee and hip. So these cases are my friends, my colleague cases that I have helped somehow, but they are not my actual friends. I work with 3D printing since early 2013, so I have some experience in this new technology, and I use it in my daily basis and my daily basis cases. I'm going to show first a video. It's a very quick video we have presented in a AAOS meeting in 2017, where we show how to create patient-specific guides for a knee osteotomy. Let's show you here very quickly. So the most important part of this video is to have the correction done with the patient-specific guide. I'm going to show very quickly here. We're using a normal knee, so we are planning a osteotomy, as you can see here, to correct a valging osteotomy, to correct using a locket plate, to correct a 10-degree deformity. So here we are planning the osteotomy, as we can see. We now going back to create our patient-specific guide. Is very easy, just draw a square over the medial part of the proximal tibia, and here we have our guide. This guide attaches to the medial part of the tibia and show us where to drill the proximal and the distal screws for the plate and exactly where to place the osteotomy. And the surgery is done. By doing that, we just have to fix the plate into the pre-drilled screw holes, and the correction will be automatically done or automatically corrected by the time we place the implant. So by doing that, we do not need any fluoroscopy and any other ways to check for the correction if our plan is correct. So creating a patient-specific guide, we can make sure that our plan is replicated exactly during surgery. Here is the same video, the same planning in a better way. As you can see, this is just the position of the locket plate, and here we are performing the osteotomy itself. We are placing the screws in the best position as we want. We can place whatever we want, and by doing that, the next step is just to create a patient-specific guide in order to replicate exactly this planning we are showing you here in the computer screen. Here we can see a normal knee, the knee we used in this example. We are rotating it in all the views in order just to see how it's done. Okay, let's move. And here is our 3D plan, just showing the video. With these technologies, we can make sure everything is in the correct position, the best angle for correcting the patient anatomy. This is a very simple case. Actually, this is a normal knee, so this is very important for difficult and more challenging cases. So we think having the knowledge of this anatomy and in this kind of way to correct things is very interesting. This is a hologram. We are using the HoloLens glasses. It's a mixed reality glasses that we placed our osteotomy plan in our office, just this office as we are recording right now. So we are using mixed solutions, 3D printing, 3D planning, and even mixed reality with holograms to create and to plan our surgeries. Here we have a very difficult case. You can see it's a patient that has a deformity in her both knees. Here we have the CT scan, the 3D reconstruction of her both knees. And here we have some more direct views. As you can understand, this patient is not mine, it's a colleague's patient. He will perform a total knee replacement in this patient. This patient has not been operated yet, so I don't have the final x-rays. We are still actually planning what to do. We have just 3D printed a small scale model to make sure what we are going to do. And now we are going to 3D print the models for the surgery itself. And I really think that in next year we can present you again here in Dubai. So here we have, here we have another case. It's a proximal tibia fracture sequela, as we can see here. We have mirrored the normal knee onto the affected side. The normal knee we can see here in yellow and the affected side in white, in order to understand where is the deformity and how to correct it. So by doing that, we choose where to place our plane cut to do the osteotomy. As you can see here, we are using a regular CAD software. It's a software that's available for everyone. It's not a medical software, it's a regular CAD software we can use for any kind of 3D work. And here in green we have the osteotomy done and how we want to be the correction to be in this articular surface. We have more details right here. So here we have that knee with the posteral medial defect. Here we have our plan cut. This is where we plan to make the osteotomy. All the views. And we have created, here we have the corrected position. It's not good in this image, so I have placed another image here in the next slides. And here we have created a patient-specific guide in red. As you can see, it attaches to the anterior medial part of the proximal tibia and shows the direction for the plane cut and the exact position. We're going to see here. So it's a very simple square that is just adapted to the proximal tibia and show where to do the osteotomy. Here we have the 3D printed models. Let's play all the models together. We can see the position, the 3D printed model that we have used during surgery. Used the guide, used the 3D printed models in order to make sure the correction was done in the best way and the best fitting position. Here we have printed a model with the osteotomy done in order to make sure before the surgery, try our best to choose the best implant and where to place the implant in order to make sure how we must achieve the correction during surgery using the model and using our view in surgery. We have some cases for hip. This is a patient that we're going to show in the next slides. This is a 15-year-old patient that have a very dysplasic hip. The surgeon planned a total hip replacement, total hip reconstruction. So we have 3D printed these models in order to help the surgeon do the best surgery possible for this patient. I think for these cases, in young patients, in very difficult cases, 3D, you have to do everything that are in your hands to make the surgery perfect. This is a patient that cannot accept a very good surgery. The surgery must be perfect. So that's why I think 3D printing is important. In these cases, I think 3D printing is important to have all the means to do what's the best for the patient. We have here a patient with a right hip sequela. We can see here in the video, as you can see, and the 3D model. Here we used 3D printing and 3D planning to help plan the surgery. I'm going to show in the next slides. So we have mirrored the normal side that is in red over the affected side that is in white, as you can see. And we can see in 3D it's difficult to see here because of it's too bright, but in the image just below my face, we can see the defect that we have to reproduce and how unstable it could be our arthroplasty. So for that, we made a 3D printed model in order to help the surgeon predict problems, choose the best implant, choose the best available implant, and every means that are important to make this surgery easier and with better results. This is another case, a patient that has a dysplasic hip in both hips. We have 3D printed her left hip. We can see here the hip and the proximal femur. And here we have the models that we have 3D printing for planning a total hip arthroplasty. Here is one of my 3D printers. We can see some of the models we have printed for this case. This is just from the printer. We can see we still have to do some work to cleaning it to make it perfect for the surgery. And this is our day-by-day cases. Sometimes I have some help. This is my child helping me selecting the cases and kind of playing with the cases we have here in our office. I really think for hip surgery it's important to understand the anatomy, but we can also use for evaluate movement and biomechanics. Here is that case, that 15-year-old case that we can see in 3D. We can place this surgery holographic in our OR. This is a normal hip. It's a patient that had a vascular necrosis. The exterior part of the hip is normal. There are other softwares like this from Clinical Graphics. The Zimmer Biomet company bought this 3D company, and they evaluate movement and biomechanics of the hip using their proper solution. As we can see here, we can check for defects, we can check for impingement and everything, but we can do it ourselves using regular free CAD software. We're using a free software called Mesh Mixer just to do almost the same. We are using the hip, we are evaluating all the movements we want, flexion, extension, abduction, adduction. We can do it ourselves. Of course, for normal cases, this is not needed, but to have the surgery done in the best way, and when we have deformity, I really think this knowledge I'm showing you guys is important and can be a helpful tool for your practice. We are using, as I said, mixed reality. We are using sometimes mixed technologies, just like 3D printing, 3D planning. This is our OR. I'm using a holographic glass. This is the HoloLens, where we can place the exams wherever we want during surgery. We can place the 3D model. This is a normal model. This is this is a patient that will be performed a arthroscopy, a hip arthroscopy. So we can place the digital model in front of us, and as you can see the OR room, it's important to say that I work in a private practice clinic. I work for myself. I have no university, I have no engineers, I have no one doing this. This is all done by from an orthopedic surgeon that can be done to a orthopedic surgeon to help their practice. So all this technology, of course, it requires some time to understand and to use, but all of these are done from the start to the end from an orthopedic surgeon that is me and some of them my colleagues. So I think that that lecture could inspire you performing and evaluating and checking for this new technology, and maybe create yourself your own cases. I really think that MRI and CT scans are the exams we use today, and 3D printing, 3D planning are the future exams for tomorrow. And thank you very much for having me here. I'm very, very excited to be participating with you, even in a digital way. But please, I will ask you again, feel free to contact me if you have any doubt, want to know the softwares, everything that it's done. Most of the softwares I use are free. Everyone can download. They are not my softwares. They are softwares that are available for everyone. So thank you very much. Bye-bye.